Menopause is one of the most challenging times in a woman's life. I can say that because I've seen so many women suffering. And if you're a woman, you better listen to this. Hi everyone, my name is Dr. Green from Dr. Daktari. I've come to you with news on different matters on health, and today we're going to discuss the challenges of menopause. And why is it so challenging? Tune in. Okay, because this is serious and I don't want to miss anything. So we need to get everything that we need to know so that we can equip ourselves to a smoother menopause. It cannot be lack of challenges, but at least we can make it less challenging, and we can show compassion and understanding to those going through menopause right now. So what is menopause? Usually we define it simply as the cessation of menses, when the monthly bleeding stops for a period of about 12 months consecutively. That's when we say the woman has undergone menopause. But menopause can happen or starts happening long before that. We have 3 seasons. We have premenopause, perimenopause, and postmenopause. Okay, so in all those stages of life, there are challenges that come with it. Life is going on, but menopause is also progressing in itself. Premenopause is that period before a woman starts undergoing any stages of menopause. So you can say from when a woman starts menstruating, or from when menarche starts, until the age of about, for most women, less than 40 years. Then from 40 years, or for many women right now, it starts earlier than that. Around 38 years of age, people start undergoing a period of perimenopause. Perimenopause is when a woman is starting to go through hormonal changes that are leading or are preparing her body for menopause. So before the monthly bleeding, or before the menses actually stop, you undergo a period of changes in your body, in your hormones, even mental changes that prepare you or that take you through to a period of menopause. So menopause is when the periods actually stop. Then you go through or you go through post-menopause period. So in all those stages, there are things that women go through that have not been very common, even to us doctors. Most of us are not well versed with the concept of menopause. So you might find a woman struggling from doctor to doctor with symptoms that she doesn't understand. All tests are showing negative, or everything might seem somewhat normal, but a woman is going through different challenges. And as a medical personnel, it's not always that we can help that woman, because most times we also don't know that that's menopause. So it's only now that people have been opening their eyes towards the menopause concept and studying what really goes through a woman's body during menopause, and it's only now that we realize that some of the things that we didn't understand are associated with menopause. Okay, so as I said, we expect menopause for many women to start between the age of 45 to 55. That's when we expect that a woman must have ceased having menses. But the premenopause period or perimenopause period usually starts 7 to 10 years before that. So for 7 to 10 years, a woman can be undergoing symptoms that are menopause-like while still having her periods. So, and the period of perimenopause is usually worse than the actual menopause itself. That's why it's so confusing. During menopause, hormones, we call them sex hormones, in a woman's body starts to decrease, and those are hormones that are known as estrogen and progesterone. So when these hormones decrease, they cause different signs and symptoms. As you've recently known that estrogen has receptors throughout the body. It's not only a sex hormone, but it's also a hormone that it's present in many areas of our bodies, including her brain. So that's why the signs of perimenopause and menopause can affect a woman generally in any part of her body. And that's why it was so hard in the past to know that these signs are associated with menopause. So let's start with the first signs. The first signs, or the most common signs of menopause and perimenopause that we know, are involving our vasomotor system. So it's the hot flashes that we get, the night sweats, poor thermoregulation. A woman is not able to regulate her hot and cold environment, and heavy sweating. So everybody else can feel somewhat normal, but you find a perimenopause or menopausal woman sweating and telling you it's very hot. Can you decrease the temperature of the AC? Or they start sweating heavily, and it's very challenging. Some people get it frequently. Can you imagine a woman who is a member of a board or a director or presenting something important in front of people, and then suddenly they start experiencing the hot flashes? Suddenly you're sweating, you feel so hot, and it's like a heat that is burning throughout the body. It's not just feeling hot, the normal feeling hot. It's very intense. So it can be very challenging to a woman, those signs of vasomotor. Then we have the genitourinary symptoms. For example, vaginal dryness. So a woman experiences a dry vagina. Usually the vagina of a woman is supposed to have some kind of moisture or mucus, so it's not dry. So when it's dry, it causes itching, it can cause pain, dyspareunia. Dyspareunia is pain during intercourse. Then a woman can also experience recurrent UTIs, urinary urgency. You're not able to hold your urine. Whenever you feel like you want to pee, you must go at that time. So that is also associated with perimenopause and menopause, and the decrease of the hormones, or estrogen and progesterone. Mood disturbances. As we said, receptors of these sex hormones are also found in our brain. So when the hormones decrease and our body has not fully just adjusted to it, we can experience things like anxiety. You find a woman who was confident and calm in herself and her own skin now suddenly started experiencing episodes of anxiety, depression, intense sadness for reasons that she cannot fully explain. Memory impairment, brain fog. You start forgetting stuff. You want to say a word, it's right under your fingertips, but you just cannot catch it. Forgetting. You start experiencing some palpitations, heart palpitations, a lot of disturbances, which causes your mood to fluctuate. You're sometimes angry and you don't understand what is going on in your own body. Headaches is also something that you explain. Myalgia, you feel muscle pain. Women, I've seen some women myself before I knew these things. A woman comes to you and tells you, my body is paining, and I feel pain everywhere. So you take examination, you test. There is no fever, no infection. There is nothing really you can find that could explain the pain that she's experiencing, but she's experiencing pain. So that is also associated with menopause. Insomnia. Some people experience disturbances sleeping. You cannot sleep well as you used to. Sometimes you wake up in the middle of the night, or you just flat out fail to fall asleep, but yet in the morning you have to go to work. And these women are usually at the peak of their careers. They are usually important big people in their corporations or in their offices, and they're people that are depended upon. So when you cannot sleep, that means you cannot function well in the morning and your mood is disturbed. So you can imagine how suddenly the life of this wonderful woman is being challenged. Hair loss, low energy, low libido, fatigue, you're tired all the time, you experience some dizziness. Some women report experiencing sore breasts, sensitive skin, aging, loss of interest in anything, self-driven lady, powerful, and now they're not interested in doing anything. They just don't have that mood. So that is also associated with the decrease in hormone in menopause. Also, we have some cardiovascular risks during the period of perimenopause and menopause. Women have an increased risk of things like stroke or myocardial infarction, also known as heart attacks, and things of the like that are cardiovascular risks. We also have osteoporosis. During menopause, the decrease in the estrogen hormone prevents the absorption of calcium in the bone. It causes a woman to have weak bones. So the weaker the bones, the higher risk of getting the decrease in bone density or the decrease in bone calcium causes higher risk of getting fractures, causes the woman to experience body pain. So a small fall that wouldn't have affected her at any other point of her life now causes a fracture. She's hospitalized for a long time, or she's experiencing bone pain. I've seen a lady who was experiencing bone pain, and she went through so many doctors. Every day her complaint is the same, that she's feeling pain in her bones, in her legs. So many tests were done to her in her lower back. Nothing is really seen. Everything seems normal, but she's experiencing so much pain. So now what she was doing was moving from one hospital to another, and then when finally she met another woman who was going through something similar, that's when the woman advised her, maybe you should see a gynecologist, because I think your symptoms are like the ones that I was experiencing in our stories due to menopause. So that's when she decided, okay, maybe I need to see a gyne. And a gyne is not someone you expect you need to see because of bone pain. Usually we think a gyne is, by the way, a gyne is a doctor who deals with women issues, reproductive usually, and women issues, gynecological issues. So you do not expect bone pain to be a complaint that should take you to a gyne. And it's not even common for a doctor to advise a patient, oh, you have bone pain that is not explained by anything else. Maybe it could be menopause, so you need to see a gyne. It's not something that will come to you easily. So this woman suffered all the while rounding to see different doctors who have nothing to do with what she was going through. So finally she met a gyne. She was started with hormonal replacement therapy, and she also got some psychological help, and now she's doing extremely well. But that wouldn't have been the case if everybody knew, or if we all knew, if she had been exposed to the fact that menopause can lead her to experience something like that. But she suffered because the knowledge is not common to everyone. When we speak of menopause, it's not just hot flashes and cessation of monthly bleeding or of the menses. It is so much more than that. And women go through so much, and they require your grace, but not only your grace, they also require your understanding and your awareness, so that they can get the help they need for the condition they are facing. Something I forgot to mention, another challenging thing in menopause is weight gain. During menopause, I think due to the decrease in the hormones of the body, which causes slowing down of a woman's metabolism, a woman experiences weight gain more rapidly than it was ever before. So you start experiencing some women who did not have weight gain around